Welcome back to Mayo Clinic Radio. I'm Dr. Sanj Kakar.
And I'm Tracy McRae.
According to the National Institutes of Health, in the past 30 years, the prevalence of childhood obesity has more than doubled among children ages 2 to 5, has nearly tripled among youth ages 6 to 11, and also more than tripled among adolescents ages 12 to 19. Lifestyle choices, food portions, and the lack of physical activity have led to increased weight gain in the past few decades. Today, 1 out of 6 American children are obese.
1 out of 6. Obesity in childhood can lead to lifelong health problems, including heart disease, type 2 diabetes, high cholesterol, and high blood pressure. In addition, being overweight can lead to social and emotional problems for children as well. So, what can be done about the childhood obesity epidemic? Here to discuss the topic is Mayo Clinic Psychologist Dr. Bridget Biggs. Welcome to the program, Dr. Biggs. It's nice to meet you.
Hi, thank you. Good to meet you too.
1 in 6 children, does that sound right to you?
Yes.
My goodness. And is there a one only reason why, or is it a multitude of reasons?
It's definitely a multitude of reasons, but I think the primary reason why we're seeing such an increase over the last several decades has really been about lifestyle in our society and other societies that are seeing similar increases in the rates of obesity.
And how do you know if your child is overweight? Do they look overweight, or is there a chart somewhere that we should be worrying about, us mothers and fathers?
Well, kind of the quick and dirty way of looking at a child's health is body mass index. What that is a ratio of weight to height. And for children, we take into consideration the child's gender and age as well. And body mass index percentile relative to other kids, their age and gender. Once children reach 85th percentile or above, that is an indicator of potential overweight. And then 95th percentile and above is considered obesity. BMI is not a perfect indicator. There are also children who are very muscular and athletic and have an elevated BMI, but it is a very quick and inexpensive way of taking a quick look at the possible risk for other health problems that a child could have.
When they're little, when they're babies, when they're toddlers, you go in for those wild child checkups and they say your child is this percentile for height and this percentile for weight. Are those, even those infant type of indicators, are those good indicators if the child is going to have an issue?
They're the first place to look. Really, I think it's more important to take a look even more broadly at what are the eating habits that a child is developing over time and what are their physical activity habits that are developing over time. You can certainly have a child who is technically in the healthy BMI range or has a healthy weight to length ratio, but if they're sitting all day and not having proper nutrition, that isn't very healthy either.
So I was surprised with these statistics. I always thought that obesity was something you'd worry about when your child was sort of 11 years of age or older. You're talking as children less than 2. And so, just explain this to me, because in our house we have a young family and feeding time's like a zoo. And sometimes the children want to eat and sometimes they don't. Right. How do we distinguish between fussiness of a child not wanting to eat and they're full up versus them needing to eat? How should we do that?
Yeah, I heard a really great saying at a conference. Parents provide, children decide. So if we are providing our children with healthy options and a regular schedule of eating, they're going to determine what their body needs. So it's very, very typical for some young children to barely pick at their plate, one, and then ask for second helpings on another occasion of eating. But what's most important is providing healthy options, plenty of variety, plenty of fruits and vegetables, and having some regular meal times and eating at the table as a family.
So that's a great way to look at it. The parents provide, how does that?
Parents provide, child decides.
Okay, because if you think, well, the only thing my kids will eat is macaroni and cheese and chicken nuggets, then that's what you're going to want to make all the time. But no, it's the other way.
It might be easier in the short run.
Right.
I can see why parents would go that way.
Well, because you feel like they should be eating something for every meal, but maybe that's what's gotten us to this point of an epidemic.
Right.
I'm surprised, Tracy, you know what's on the food menu in our household every day.
It used to be, when mine were that size, it used to be.
So as adults, we talk about 3 meals a day and try and cut back on the snacks. Mm-hmm. What about children who are young as 2 and growing? Should they be having regular snacks along the way as well? Or
Most children will eat 3 meals and probably 2 snacks during the day, depending on the gaps in between, 1 or 2 snacks, depending on the gaps between the timing of meals.
And what are the hormonal implications as a child is growing if they're overweight? It seems like I've heard that's where girls can start menstruating earlier, or how does that all fit into the mix?
This would be a great question for my colleague, Dr. Seema Kumar, in endocrinology. But what I've learned from her is that we can see early puberty in children. We see that especially in girls. Increased risk for PCOS, polycystic ovary syndrome, and a lot of other kind of hormonal difficulties.
All right. So, we'll leave that for the endocrinologist on another day. But for the psychologist in you, how do you help children then? Are you helping their parents more, or are you helping the child more when it comes to trying to manage the obesity?
I work with families. So really, we focus on health behavior. How are you treating your body? What kind of nutrients are you bringing into your body? And how can the family as a whole develop these healthy eating patterns, such as regular meal times, turning the electronics off during meal and snack times, eating at a table as a family, listening to their stomachs to see when they are full, and kind of retraining that, because we train ourselves to eat more than what our bodies really need a lot of times. Doing physical activity as a family. We work on goal setting. What's a reasonable goal? So as one teenager wonderfully pointed out, you can tell me to eat by my plate, but that's not realistic for me right now. So, okay, let's start with where you're at. What are some realistic goals for you?
So there are mums and dads out there who, yours truly, who put the TV on just to calm the children down, and then they will eat their food. Is that a bad practice pattern that I'm doing?
I wouldn't recommend it.
He's got a lot of kids. When he says it's a zoo, there's a lot of kids over at that house. Why is it a bad idea?
Well, with TV, it gets us distracted. We aren't even noticing our food. I'm sure all of us have had that experience where we're really into maybe a TV show or a sports game that we really like, and next thing we know,
or the movies,
and we look down,
eat that whole popcorn.
Exactly, we look down and everything's gone, and so we're just not paying as much attention to what we're eating and to our satiety signals. Also, just having screens on, any kind of screen, often opens us up to other advertisements, oftentimes for food. So we're getting signals that we should be hungrier, perhaps even when we're not, and also getting signals that maybe we can be happy if only we would eat this snack food, for example.
Do you have the situation where the child is dealing with obesity and then you turn around and look at the parents and say, okay, this is going to be a family deal? Is there pushback from those parents? I mean, obviously they know that they also have an obesity issue, but how does that work out if people are maybe a little hesitant to the message you have for them?
I think families are at different places of kind of where they're coming from, what their experience has been. And I always try to listen to where the family has been, what have their experiences been, and what are they interested in doing, what's motivating them for coming to the appointment, and we'll work from there.
So you've worked with families and you've made diet and exercises choices, but still the child has some obesity. Are there other medications, for example, that children should start, or what's your thoughts about that?
Well, I work in a multidisciplinary clinic with Dr. Seema Kumar and several dietitians, and it's in that clinic that we see some of the more severe cases. So once kids and their families have been working on healthy lifestyles, they're making some progress but may need some additional help. There are unfortunately very, very few medication options that are available to kids. There is a bariatric surgery option, and we do have a program for that here at Mayo Clinic for adolescents. But those are always tools that help support the lifestyle change. They really don't work unless working on healthy eating and physical activity is part of that.
We've been talking about childhood obesity with Mayo Clinic psychologist Dr. Bridget Biggs. Thank you so much for joining us, Dr. Biggs.
Thank you for having me.